Guten Morgen, meine Damen und Herren. Bonjour, Monsieur, Dame. I've been having presentations in 5 of my languages, but never in German, because the German colleagues, for some reason, never asked me to do that in German. So I'll continue in English. So I come now from the University of Tampere. I studied engineering, mechanical engineering in the beginning, and then later on switched into safety and health engineering, and now lately it's more health engineering than safety, because health problems are much more long-term and much more prevalent also. Also in terms of mortality, they are much more important than, for example, injuries. And that's one of the reasons asbestos is one of the key points, maybe the most single important risk in the working life in practically all over the world. I have an international career, 26 years with the International Labour Organization. I studied with the Finnish government originally in Finland, but then in the ILO, in Africa, in Asia, and then some 20 years in Geneva, here in Switzerland, had a house in Canton de Vaud at that time, already sold out and don't have really any other connection, but I still work for the ILO from time to time. For example, setting the rules on different items. Asbestos has particular rules, practically all countries in the world, but also now we are talking about biological risks and chemical risks and so on. So if we'll go into the real question today, the action has to be done today, so that we don't have the problems in 20, 30, up to 50 years in the future. And people in many countries, even in Sweden, in my own neighboring country, in the Nordic countries, I talked with the minister in responsible for asbestos, and they said that, no, we have banned asbestos 40 years ago now. It was some 10 years ago when I was speaking. 40 years ago, we have no problem. That's not the case. Asbestos is with us practically forever, because it doesn't disappear. And the massive amount of asbestos we have everywhere in our societies is important to keep in mind. Come into that after a while. So I'm talking about the asbestos-related diseases, trends now and in the future, looking at the cancers, long latency diseases, and the burden is really badly underestimated. Then measures to be taken, ban asbestos everywhere, removal process, exposure limits, manage asbestos in existing infrastructure, building, bridges, anything what we have built by human beings, and in the environment. So if you look at behind, we have the picture in light blue. These are the asbestos mortality figures in the global business. And that means that not a single country so far, or at least globally, we have no starting to go down with the mortality. They are going up. And one example is Sweden, and I come to that after a while. Well, these data are from the Global Burden of Disease and Injury. It's a project established originally by WHO together with ILO, where I was working. I was talking together with the WHO colleagues who are now running the GBD, and I'm one of the 11,000 collaborators that are helping to get the figures all over the world on asbestos and many, practically all health problems. They are not particularly concentrating on asbestos, but this is one of the key problems, so they have well documented that. But they also have their own limitations because they are interested in health and health profession in particular. So they don't particularly put emphasis on asbestos, on particular occupational problems. They look in general health of all populations. And that's one of the reasons they take a limited number of problems into account, and that's why their numbers are definitely not overestimated, they are underestimated. So these are the numbers for the Switzerland, what we get from the global burden of disease, and I've been contributing to this as well. So the biggest problem what we have in Switzerland is clearly lung cancer, 990, the figures. There's a confidence interval, uncertainty interval, it's about 20% up and down, but it's in that range. So whether it's 900 or 700 or 1,200, that's the limit more or less where we are. And totally they came to the figure of 1,238 for Switzerland. So that again has the 20% confidence interval up and down. If we compare to Finland, for example, and comparing the asbestos consumption has been much higher in Switzerland. And the population is not really the major factor. The problem is really the consumption, how much asbestos has been used in Switzerland. So we have used less than half of the asbestos what you have used here in Switzerland, but we have much more than half the mortality. So there is a link between this and Swiss numbers, that the Swiss numbers could be higher, and come into that after a while. So if you look at the European Union, and that's one of the things what have lately started to seriously look into the question, and I'll come into some of the details later, but European Union has done a lot of work now lately for eliminating the future asbestos burden as well. So their problems is the mortality was altogether 90,000 people dying in the European Union. The population was 520 million. If you look at the particularly more detailed study, what we have just recently, in fact, published March this year, 2024, we come to a figure that asbestos, for example, is underestimated in the global burden of disease problems. So we came to a number of deaths caused by occupational cancer is 1,800, and it could be close to 1,500, 600 for the asbestos itself. So this is a detailed study, and you can have a look on those details and backgrounds and references. There are altogether some 400 references behind for that problem. So if you look at the major four problems what we have now, and that's not the all still, four problems are mesothelioma, larynx, ovary cancer, and lung cancer. So lung cancer is absolutely the most biggest problems in terms of asbestos. And if you look, for example, the difference between Switzerland and Sweden, Switzerland is here on the lower level, and this is based again on the asbestos consumption in 1970s, 80s, having mortality today. So I think this is also showing that Sweden has a lower number of asbestos, but they banned 40 years ago. And the ban in Switzerland, I don't know when it came to force, but it is not likely to be in 1980s. It's more likely like the European Union 1990s or 2000. So this is another problem comparing the two. If you look at the same figures for mesothelioma, why mesothelioma? Because it's not the biggest problem. Because mesothelioma is only caused by asbestos. There's no other cause for mesothelioma than asbestos exposure. And if you have mesothelioma cases, then you know that there has been asbestos exposure. And if you have asbestos exposure, then you can count the lung cancer cases, larynx cancer cases, ovary cancers, and also maybe stomach, colon, colorectal cancers, and other nasal cancers, and so on, based on that mesothelioma mortality and mesothelioma incidence. So that's why mesothelioma is a very important indicator. So I think we have about 100 mesothelioma cases in Finland, much smaller population, and I think yours is something like 200 according to GBD. I don't know what you have in your compensation criteria and so on, but most likely much lower than what are the estimated numbers. The problem is that these things disappear, and particularly they disappear for lung cancer. The reasons for the global underestimates are coming next. Why do we have this kind of major difference between the numbers recorded and compensated compared to the numbers what we are expecting? And I think this is one of the reasons that mesothelioma is also badly underestimated already by the global burden of disease. They have something like 27,000. We made a group of scientists, particularly Japanese scientists, myself and American scientists together, made a calculation. It will be 36,000 rather than 27,000 caused by work, and 38,000 caused by all non-work and environmental causes. So that is a major discrepancy between the already including WHO and other reports what we have officially reported mesothelioma or estimated mesothelioma as well. So this is important thing. If mesothelioma is higher, then the global numbers are higher, particularly lung cancer numbers are higher, because mesothelioma is an indicator of the exposure. So the estimation in Switzerland for the last 20 years, estimates on occupational diseases, including those caused by asbestos, have been produced and published globally. They are there, but don't trust that they are absolutely correct. They are likely to be underestimates, and they are going to be underestimates in the future. So the summary is that don't believe in the official numbers because they are capturing only small number of cases. Very good example is my brother. He was a construction engineer, and when he was young, he was every summertime working in construction sites. And he told himself there's lots of asbestos around. And then he ended up in having first larynx cancer at the age of 70, and at the age of 75 lung cancer, and he died. No records whatsoever of occupational reasons or any compensation or anything like that, but caused by asbestos clearly. Calculated numbers in Switzerland compared to the global burden of disease of asbestos. Your life expectancy is high compared to almost any other countries in the world. So that means that the mesothelioma and lung cancer have time to develop. So that means that the numbers may be higher in Switzerland than in particularly poorer countries in Europe and of course in the whole world. The second important thing what I already tried to emphasize, that the mesothelioma numbers are poorly recognized and diagnosed. No X-ray devices to see the lungs, not to talk about computer tomography. So the doctors see the patient, asked, are you smoking? They said, yes, I'm smoking. Not even a talk about asbestos, and come to that after a while. Reporting to national and international statistics is very poor. When I talked to my Bulgarian colleagues, they found 55 mesothelioma cases in Bulgaria. What they report to WHO was 5. They simply ignore. So that's the case all over the world. I don't know how many Switzerland is reporting to WHO, but that is also underestimation because they are not identified and recognized. So then medical practitioners, they concentrate on the victim's treatment. They don't concentrate on the past history. Medical doctors want to treat the patient. My idea is that we have to treat the environment, the working places and buildings and so on, what you are trying to work here, rather than in the individual. It's too late to treat, because if you get a lung cancer, If you get mesothelioma, the life expectancy is 1 year. Lung cancer may be 3 or 4 or 5 years. So this is something what is too late for prevention. So these are the key points for that. So your 18,000 metric tons used between 70-80 ends up into 1,000. My best estimate today is 1,656 asbestos-related occupational deaths in 2019. That's the latest what we have today. So, and again, 20% uncertainty interval, it could be still in the same rates as the GBD. So that's roughly the case. How many? You have to count how many traffic fatalities you have in a country, and compare to that, or how many other cases for other diseases. So it's a big thing. And if you want to get that trend rapidly down, we'll have to take measures. And the only measure is to, not only, I think the list of measures, but is to try to do all what we can to eliminate asbestos exposure in the future. So, a little bit of epidemiology. If you look at this as a classical example made many years ago, 30 years ago, but certainly valid today. If you look at the rate between asbestos exposed and non-exposed by asbestos per 100,000 population workers in this particular case. So if you don't smoke, if you have no asbestos exposure, 11 persons out of 100,000 die. If you start smoking, the mortality is going to be tenfold, 123. If you have been exposed to asbestos, it's going to be sixfold, from 11 to 55. If you have both, then we have a multiplicative combination, not adding them together, but multiply. There are two different processes in our lungs. One is the smoking-related problems. It's more chemical exposure behind the smoke. And the other one is asbestos, which is mechanical, the irritation by the asbestos fibers, which are like needles in your alveolar methods in your lungs. So these two work together, and that's why if you have both, it comes from 11 to 600. And if you count what we call attributable fraction, the fraction what would not be there, the fatal cases, mortality would be not there if the attributable fraction percentage has been removed. So if there had been no asbestos, 80% of 600 would have been going down to 123. So from 600 to 120. And if you stop smoking and you never smoke, then it goes from 600 to 11. The fraction of elimination is exactly the kind of point here. Fraction of stopping smoking is 95% of cases will be eliminated if you are not smoking, but also 81% if you are not exposed to asbestos. Smoking is individual decision, but asbestos is usually not individual decision. That's an infrastructure, either employer or building owners or so, who are more responsible for that, who have not taken care of it. And our society, which doesn't take care of that to eliminate those exposures. So the first signs of getting down figures have been now got 6 months ago from the UK. Still there's a bit of a problem because in 2021 there was a different problem called COVID-19. And many people who died of COVID-19, they might have lived 1 more year because of the asbestos problem. So they died maybe because they were weak already and they died earlier. So we have to still be careful whether this is really the case that the mesothelioma numbers are going down. In practically all countries, they have been still going up. And coming to that after a while, these are the things that the estimates looks like very messy picture here, but the UK started to 20 years ago, 25 years ago, to look at the asbestos exposure, meaning how many tons of asbestos has been used. So the peak over there, the UK exposure, is quite sharp. And they expect UK 2005 was over there, and now it goes already much higher. So whether it's starting to go down, we don't really know now. But that means that if you look at the Swiss exposure here behind, it may be much longer tail over here going to 2050 or more, depending on how well you are doing it now. So that kind of tail, you can still have an impact. You cannot eliminate the past exposure. You can eliminate in the future. One important thing, I mentioned Sweden over here. In Stockholm, one of the most heavily polluted by asbestos locations in Sweden because of the buildings and so on. So the trend started to go down because they banned asbestos 40 years ago. Exactly 40 years ago, and now they started to go up again in 2000 and 2005 and so on, and still they go up 40 years ago. So when you banned asbestos in Switzerland, you may see that it may have an impact until a certain point and may start again going up because of the demolition and the asbestos in the infrastructure and in the environment as well. So it's not exactly so visible in countryside, but in big cities it's important. So the limit what we made, coming back to the elimination here, the limit what more or less I'm one of behind those authors of the Global Asbestos Disaster Paper. We proposed the limit of 1,000 fibers per cubic meter. Then there was a long discussions. European Parliament agreed. I had talks with all the European Parliament groups, apart from the Marie Le Pen group, where the particular group who were not interested in that. But all they agreed, and with the huge majority, 654 and some 20 against, was agreed by the European Parliament that 1,000 fibers per cubic meter is correct. Then there was a long process of negotiation between the Commission, the Parliament, and the Member States, the Council itself. And then the compromise was finally to have 2,000 fibers per cubic meter and a long latency time between now and 2029. So it comes, but 2,000 fibers measured by a better device. They defined electronic microscopy as a method. If you use phase contrast microscopy, then you may have much stricter limits because you don't detect so many fibers, what you detect with either scan or TEM, transmission electron microscopy, which is considered the best way to identify the asbestos today. So more or less this went through with a long latency time, this 1,000 fibers, if measured by TEM, transmission electron microscopy. I was present in the European Chemicals Agency meeting, and we looked into the figures, and the past levels cost this 90,000 in the European Union, and if you go to 10,000, you will go down with the risk, which is 10 times smaller. If you go to 1,000 fibers, it becomes 100 times smaller. So these are the reasons behind, and there was a lot of lobbying between the different kind of people and political decision makers. But it finally more or less accepted by the European Union altogether. So the directive says that by 2029 it must be 2,000 fibers per cubic meter measured by electronic microscopy. They don't say TEM. Scan is also fine, but TEM is clearly better. And up until 29, it's 0.05 or 10,000 fibers per cubic meter. 10,000 fibers is something what you inhale in a little bit more than 1 hour. So inhale deeply. I'm sure that you may have something like 500 fibers or maybe 600 or 1,000 or 200 fibers here in this particular room. So you inhale millions of fibers yourself all the time, either here in the building or outside the building, particularly in cities. Even in countryside, that's the case. So we looked at the environmental idea. So I was talking with the Institute for Arbeit und Gesundheit in near Bonn, St. Augustin, in totally agricultural field. There's only agricultural installations, and this institute is located over there. And their expert measured it on the wheat field, far away from anything, 200 fibers in the wheat field. So that's something what you are definitely having here, but it likely to be much higher. In the ILO building, next to the WHO building, next to US Embassy in Geneva, we studied from our building 600 fibers inside the building. So I was exposed to that in my room. And outside the building, it was 900. And the intake filtered the rest of the 300 when you get the air from outside into the air conditioning system of the building itself. So 900 in Geneva, which is not industrial city at all. So I think this is important that if you have industries, if you have buildings, if you have traffic, railway brakes, still most of the railway cars, they have asbestos in the brakes. Cars, less and less, particularly new cars, but trucks and also all the trucks have lots of car brakes containing asbestos. But these are the levels. But if you start demolition of asbestos, in the nearby you may have, like in Poland, up to 30,000 fibers per cubic meter today. So immediately surrounding that, and asbestos, of course, with the rain, it may go down. But then if it doesn't, particularly, say in the wheat field, every spring they are using the plows and it comes up again. So it doesn't dissipate just like that. Or it may come to the rivers and water systems, and it's used again even by your own drinking water and so on. So these are some of the items behind. Also, one important thing to measure, how can we make a difference between males and women? And why that is important? Because males have been exposed by work. Females fairly seldomly exposed by work. So they are more exposed by environment, by the streets, by the buildings, and so on. So if you look at the Scotland, very heavily polluted by asbestos, shipyards, industries, using massive amounts of asbestos in Glasgow and so on. So they can see some decline now for male population. But if you compare to females, they are going up. And that's the environmental component. Again, household, buildings, street, anything else what you have. So that's the environmental exposure. So that is still there, and that's important thing to keep in mind. So the recommendations is we have to make sure, most of you are exactly working on that business, have the survey what goes on and make careful that you don't expose yourself, and removal before any renovation starts for the buildings. That's one of the reasons for the European Union, that they had a massive sort of reconstruction plans for all buildings in the whole European Union. And that means that massive amount of asbestos may come to there if you don't take care of that. And then the capability and capacity of the surveyors and authorized companies should be dealing with the problems, not anybody from the street. And all asbestos-containing buildings identified, marked and mapped. That's not easy, because if your building will be marked by asbestos, saying that this building contains asbestos, nobody wants to live there. But that's one of the solutions. If you want to tell people to be honest, then that's one of the solutions. So then you have all kind of exposure registers and other methods, but I think these are the key points. But you are responsible now to go and take care of in your own area. So thank you very much for your presentation.